Well, total cost of ownership is a big word, right? And so we have to look at sort of the acquisition cost. We have to look at any maintenance or upkeep. We've got to look at certainly the personnel, the FTE cost, and any disposables, right? But there's another piece that sort of goes along within this in a value analysis equation, and it's really the most important, which is the patient or the clinical perspective, right? So when we look at any value analysis sort of proposition, it has to start and end with the patient. How is this going to help the patient and the caregivers, right? From a clinical perspective, is this going to improve clinical outcomes? In this case, we're looking for reduction or elimination of surgical site infections. We're looking for sort of that second layer of outcome measures is, reductions in VOCs and CO2. And, are we improving door openings? Are we making you more compliant with temperature and humidity as an example? There's operational outcomes, right, which are sort of that next level. Are we improving things like operational efficiency? Are we making your door openings less, so that we're, really making the procedures a little bit more effective? And then lastly is something that we have to talk about because healthcare is also operating as a business too, which is finance. And, finance, there's dollars and cents, but there's also the cost of preventable negative outcomes like infection or loss of reputational management because a patient thinks our facility is not doing everything necessary, or they, sadly get a preventable infection and they take that reputation elsewhere, right? So there's a lot that goes into this sort of conversation around the value analysis perspective, and I think it's important to work with value analysis professionals to have that sort of big context conversation around total cost of ownership and also what the facility's goals and desired outcomes are.